Let's discuss the extraordinary vessels, the origin. The 8 extraordinary vessels, synonyms: extraordinary meridians, wondrous meridians, meaning of Qi, Jing by Mai. Qi, extraordinary, strange, not paired, miraculous, wonderful. Jing, channels, meridians. Ba, 8, first differentiation. Mai, vessels. The 8 extraordinary vessels are not channels such as the Jingmai, but they are, as the same implies, extraordinary. While they are often mentioned together with primary channels, they still play a special role. Theories about the origin of the extraordinary vessels. The 8 extraordinary vessels are often considered to be the deepest and most original structures of the body and channel system, developing very early during the embryonic phase. They are considered to cover all the human activity. They also initiate all secondary function and always remain operative. Therefore, their pathologies manifest with complex symptoms and include pre- and postnatal essence problems. The Nanjing is the first to describe the extraordinary vessel as a complete system. Earlier records only mentioned them individually in the context of their respective functions. Origins of the extraordinary vessels. In order for the manifestation of life to develop, the body requires structures that keep the rhythm of Qi and its related processes in harmony and balance. The Nanjing introduces the concept of an energetic center in the body, in the human body, the moving Qi between the kidneys, which is often seen as connected with the Mingmen and Qi Hai Dantian, and is subject to the influences of the cosmic as well as the peripheral and postnatal Qi. According to Matsumoto and Birch, the moving Qi between the kidneys represent the Tai Qi of the body, and the great one, the origin of yin and yang. It is considered to be the root and the origin of all human system and structures, and according to some authors, it has connection to the original Qi, the Yuan Qi. The Chongmai, as the oldest vessel, is sometimes equated with the moving Qi. The Renmai and Dumai represent the basic division of the yin and yang in the body. In other words, they originate from the moving Qi or Chongmai as yin and yang branches. During the invasion, one movement ascends the front of the body, the Renmai, and the other movement, the back, Dumai. Heaven and earth have noon and midnight. The body has the Renmai and Dumai as its polar axis. The Dumai, Renmai, and Chongmai have different names, but in the end, they are the same and have the same significance. The Chongmai ensures the inseparability or unity of the Dumai and Renmai, of yin and yang. If we tried to separate yin and yang, we would have to realize that they are an inseparable whole, a unit. Therefore, the extraordinary vessels function as a kind of matrix, which is the source of energetic functioning and the cellular division in the body. This matrix is present from the moment of conception and organizes the structuring of the embryonic development from the earliest stages. So we have here the origin of the channels. The first level, the great one. Second level, separation. Third level, the yin and yang. And the fourth level, 4 body areas, 3 burners, then the 8 extraordinary vessels. Then from the 3 burners, we have the 6th level of great channels, then the 12 channels. In the beginning, there is the great one, the Tai Ji, first level. At this level of no form, the great one begins to separate the second level and becomes yin and yang, which is the third level. At the fourth level, yin and yang separate twice and have the 2 branches. The one branch separates in a threefold way to become the triple burner, the Sanjiao, and its associated form of Qi. Further separation lead to the formation of the 6 great channels, the 5 phases and their source, as well as the 12 primary channels. The other branch separates at the 4th level to form the 4 body areas, left, right, above, below, and then the 8 extraordinary vessels. Scholars of the first cell division, Matsumoto and Birch, comment on the work of Manaka and others who interpret the extraordinary vessels with regard to embryonic development, regarding them as scars or lines of separation of the first cell division. The Dumai and Renmai are the result of the first division of the fertilized egg, while the Daimai develops during the second division. At this stage, the embryo is essentially a torso, while the extremities and more peripheral extraordinary vessels, the Yang Qiao Mai and the Yin Qiao Mai, as well as the Yang Wei Mai and the Yin Wei Mai, only formed during the subsequent divisions. The 8 extraordinary vessels and body structures. According to Manaka et al., a close connection exists between the 8 extraordinary vessels and body structures symmetry. The Dumai and the Renmai separates the body vertically into left and right. The Renmai marks the anterior midline and the Dumai ascends the posterior midline. The Daimai circles the waist horizontally, forming a horizontal axis. It separates above and below. In a further development of this idea, Manaka describes the division of the body into 8 areas, using the structure of a topological octahedron for illustration. In this model, the 8 extraordinary vessels directly relate to the lines separating the faces of the octahedron. Due to their location on the anterior-posterior midline, the Renmai and Dumai separate the body into its right and left section. The Daimai separates above and below. The Jibei and Tibia channels compared to the anterior and posterior dividing lines at the lateral edges of the yang aspect of the body. The pericardium, the spleen channel, compares to the anterior and posterior dividing lines at the lateral edges of the yin portion of the body. The opening points of the extraordinary vessels, with the exception of spleen 4, a point on the liver channel would be more appropriate, representing this division. PC6, TB5 are the opening points of the Yin Wei Mai and the Yang Wei Mai, respectively. Spleen 4 and GB41 are the opening points of the Chong Mai and Dai Mai, respectively. These 4 channels divide the anterior and the lateral aspect of the body and connect the upper and lower parts, the 4 associated extraordinary vessels functioning accordingly. The Yin Qiao Mai and the Yang Qiao Mai, due to their connection to the kidney and bladder channel opening points kidney 6 and bladder 62, have a close relationship to the Renmai and Dumai. Furthermore, the pathway of the kidney channel is located close to the Renmai, while the bladder channel is close to the Dumai. Thank you for your attention.
Let's discuss the liver channel, sinew, and LUO-connecting vessel system. The liver sinew channel begins on the dorsum of the big toe, follows the dorsolateral aspect of the big toe to the anterior aspect of the medial malleolus, where it binds. Then it ascends the middle aspect of the tibia and binds at the medial aspect of the knee. Further ascends the medial aspect of the thigh between the kidney and spleen sinew channels. Reaches the inguinal region, meeting the other foot yin sinew channels at Ren 3, and continues to the genitalia. Clinical importance. If there is a pathology, there will be stiffness, tension, and distending sensations along the big toe. Pain around the medial malleolus and medial aspect of the knee. Pain and muscular tension along the medial aspect of the thigh. Disorders of the genital region. Indication: pain, tension, muscle contractions, and distending sensations along the pathway of the channel. Disorders of the genital region. The liver-luo connecting vessel system separates from the liver primary channel at its luo point, liver 5. It forms a three-dimensional reticular network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal divisions run to the interiorly-exteriorly paired gallbladder primary channel. According to some schools of thought, they travel as a transverse liver-luo connecting vessel to the Yuan source point, GB40. A longitudinal division ascends the medial aspect of the leg to the genital region where it branches out. Clinical importance. Counterflow Qi, there will be swellings and pain of the testicles and scrotum hernia. Priapism is a manifestation of excess. Itching of the external genitalia is deficiency. It is by virtue of these functions, as well as the channel pathways that were discussed, that many of the actions and indications of the points of the liver channel can be explained. This can be summarized as resolving distension and pain due to stagnation of liver qi in the head, throat region, chest, heart, lungs, stomach, abdomen, lateral costal region, lower abdomen, intestines, and genitals, assisting in the descent of stomach and lung qi and the ascent of spleen qi. Pacifying interior wind and uprising of yang, giving rise to headache, dizziness, epilepsy, spasm. Cooling liver fire, affecting any region of the body, benefiting the eyes. Treating disorders characterized by pain and swelling of the external genitals, especially in men, as well as seminal emissions, ejaculatory disorders, priapism, and impotence. Regulating menstruation and the menstrual cycle. Treating Shan disorder. This is a broad category that includes hernia, genital swelling and pain, and severe pain of the lower abdomen. Treating disorders of urination, such as urinary retention, painful urinary dysfunction, incontinence, frequent urination. Treating lumbar pain. Treating psycho-emotional disorders deriving from liver blood deficiency, liver qi stagnation, or liver fire, all of which may disturb the ethereal soul and spirit. Thank you for your attention.
Let's now discuss DUMAI, or governing vessel pathway. DUMAI is also called the governing vessel. Its relationship: first, we have a yin-yang relationship with the renmai and DUMAI. Second relationship is the central peripheral relationship between DUMAI and the yang Qiao Mai. Its regions supported by this pairing are as follows: the inner canthus of the eye, the occiput, the shoulders, the back, the small intestine, and the bladder channels. Its opening point is SI3, and its coupled point is bladder 62. Now let's trace its pathway. The extraordinary vessel DUMAI originates like the Chongmai and Renmai in the lower abdomen, and according to some authors, at the kidneys, and then emerges at the perineum and divides into several branches. The main pathway of the DUMAI begins at REN1, at the perineum, reaches DU1 between the anus and the coccyx, and ascends to the posterior midline along the spine. At DU12, below the spinous process of the third thoracic vertebra, a branch separates on either side to reach bladder 12, rejoining the main branch at DU13 below the spinous process of the first thoracic vertebra. It then continues to DU16 on the lower border of the occipital bone. Here, an internal branch enters the brain. The external pathway continues to ascend to the head to DU20, from there beginning its descent along the midline to the forehead and the nose to DU26, where it crosses the stomach and large intestine channels. It terminates inside the mouth below the frenulum at DU28, where it meets the stomach channel and the extraordinary vessel renmai. One branch of the DUMAI, the spinal branch, originates at REN1, courses to the tip of the coccyx, where it meets the kidney primary channel, ascends within the spinal canal to the space between lumbar 2 and lumbar 3, and enters the kidneys. The second branch of the DUMAI, the abdominal branch, originates at REN1 encircles the external genitalia and ascends to the umbilicus, passes through the heart, continues to the throat, circles the lips, travels to the cheeks, passes stomach 21 at the infraorbital ridge, and reaches bladder 1. The third branch of the Dumai travels bilaterally alongside the bladder channel from bladder 1 to the vertex. From here, it branches out internally into the brain. The external pathway follows the medial branches of the bladder channel in an inferior direction and enters the body at the level of the lower border of the spinous process at lumbar 2 at bladder 23 to terminate at the kidneys. Its connections with other channels and organs. The Dumai is connected to the Renmai, Chongmai, bladder, and kidney primary channels. It is also connected to the uterus, the kidneys, and the brain organs. Clinical importance. It is the sea of the yang qi, which supplies yang qi in order to warm the organs and channels. It supports and regulates all yang channels, especially those of the upper back and head. It influences and strengthens the functions of the brain, the marrow, and the sensory organs. It strengthens the body constitutionally and supports the immune system for the circulation of the defensive qi or the wei qi. It also stores the essence qi or the jing qi overflowing from the yang channels. It absorbs excess from the yang channels, especially excess heat and internal wind. Notes about the Dumai. Both the Dumai and the Renmai have a unique position among the 8 extraordinary vessels. They are the only 2 extraordinary vessels with their own specific points. All the other extraordinary vessels can only be accessed through points on the primary channels. For this reason, the Renmai and the Dumai, together with the primary channels, are often categorized as 14 channels. However, from the point of view of channel energetics, this is not correct, since the extraordinary vessels occupy a special position both evolutionarily and functionally. The pathway of the Dumai, like that of the Renmai, is limited to the torso and the head. While it does not course along the extremities and does not have any points on the limbs, neither general points nor specific points such as the 5 shoe transporting points, the Yuan source points, and the others, it does have a pertaining opening point or master point. The Dumai is also referred to as the Sea of Yang and governs the yang and the whole body. Located along its pathway are the posterior aspects of the energy centers or chakras according to Yogi tradition, while their anterior aspects are located along the pathway of the Renmai. In Taoist tradition, the Dumai plays an important role in the cultivation of qi. This concerns the development of a spirit child, which can be influenced by opening and activating energy centers located along the spine. Furthermore, the Dumai contains many meeting points with other channels. This clearly denotes the outstanding importance of the Dumai. Thank you for your attention.
Let's discuss Daimai, the gurgling vessel symptoms. Clinical manifestation, feeling of cold and pain of the middle and lower back, mid-back radiating to the abdomen, abdominal pain radiating to the mid-back, laxity and weakness of the lower back, abdominal distension, chronic vaginal discharge, prolapse of the uterus, weakness and atrophy of the lower limbs, miscarriage, cold feet, amenorrhea, irregular periods, feeling of cold in the genital area, infertility, nocturnal emission, umbilical pain, painful periods from dampness, a feeling of fullness of the abdomen, back, feeling as if sitting in water, a feeling of heaviness of the body, a feeling of heaviness of the abdomen, as if wearing a belt carrying 5,000 points, and hernia. Pulse, wiry on both middle positions. Treatment, acupuncture, GB41, TB5. Daimai pathway. It begins at the level of the free end of the 11th vertebra, liver 13, descends to GB26 and encircles the waist like a belt. It traverses the body via GB27 and GB28. Daimai function connects the upper and the lower, the heaven and earth, and supports the proper movement of various substances in the body. Daimai has a strong connection to the gallbladder and is easily affected by strong anger, suppresses anger, alcohol, greasy foods. Damp heat in the liver and gallbladder. Daimai symptoms: herpes genitalis, cystitis, sinusitis, candida, neck pain, weakness in the legs, vaginal discharge, painful rotation of the spine, swelling of genitals, painful hip joint. Daimai palpation, palpation of the quadratus lumborum muscle for pressure, pain, or tension. The patient lies in supine position with raised knees, and the practitioner presses with the medial side of the index finger in the quadratus lumborum muscles at the patient's left and right. Daimai point pair, confluent point, GB41, Yang Wei Mai coupled point. Coupled point, TB5, Yang Wei Mai confluent point. Daimai disease pattern, the following sample disease pattern can appear similar to Daimai problem and have to be properly differentiated. Hyperactive liver yang, damp heat in the gallbladder and liver qi stagnation. Hyperactive liver yang is a deficient heat pattern and arises from liver blood deficiency or liver yin deficiency. Cardinal symptoms, symptoms of hyperactive liver yang appear in conjunction with symptoms of liver blood deficiency or liver yin deficiency. The presence of deficiency sign is the main characteristic of to differentiate between liver fire and hyperactive liver yang, since they share the same cardinal symptoms: irritability, severe vertigo, tinnitus with high frequency tone, throbbing headache, migraine, conjunctivitis, redness of the eyes, red tongue, edges. Damp heat in the gallbladder and liver can result as a consequence of liver yin deficiency. And yin deficiency leads to heat, which causes the spirit to be restless. In order to compensate for restlessness, the patient may eat dampness-producing foods, and damp heat in the gallbladder and liver is a result. The cardinal symptoms: pain and fullness in the hypochondrium, pain in the testicles, jealousy, high-handed manner, jaundice, trouble digesting fatty foods, vaginitis, inflammation of the fallopian tubes, inflammation of the bile duct, inflammation of the gallbladder, bitter taste in the mouth, protrusion of the eyeballs, scrotal eczema with wetting lesions. Stagnation of liver qi, stagnation of the liver and liver channel resulting from impairment of the liver function of pre-coursing. Cardinal symptoms: feeling of distension and pain in the hypochondrium, excessive eating due to frustration or stress, irritability, moodiness, emotional tension, PMS, depression with frustration, premenstrual irritability, wiry pulse, plump pit, feeling in the throat. The liver attacks the stomach, nausea, vomiting, sour regurgitation, belching. Thank you for your attention.
Let's talk about the classical indications of yin wei mai or yin linking vessel. Chapter 41 of the Simple Question says, in backache caused by the Fei Yang channel, the pain travels upwards gradually with a feeling of sadness. If the pain becomes severe, the patient has a feeling of fear. To treat this pain, use the Fei Yang channel and needle the point 5 zone above the internal malleolus, which connects with the yin linking vessel, that is, kidney 9. Chapter 29 of the Classic of Difficulties says, when the yin linking vessel is diseased, there is heart pain and depression. The same chapter says, the yang linking vessels links all the yang, the yin linking vessel links all the yin. When yin and yang cannot link with each other, there will be pensiveness, obsession, loss of willpower, and lack of self-control. The golden mirror of medicine lists the following symptoms for the yin linking vessel: feeling of fullness, stuffiness, and distension of the chest, borborygmi, diarrhea, anal prolapse, difficulty in swallowing, diaphragm stagnation from excessive consumption of alcohol, hard lumps to the side of the hypochondrium, hypochondrial and heart pain in women, internal urgency, abdominal pain, unresolved attack of wind cold that leaves a tightness in the chest, malaria. Classical indications for the yin linking vessel. According to simple questions, backache with pain traveling upwards gradually with a feeling of sadness. If the pain becomes severe, the patient has a feeling of fear. From the classic of difficulties, there will be heart pain and depression, pensiveness, obsession, loss of willpower, and lack of self-control. From the golden mirror of medicine, feeling of fullness, stuffiness, and distension of the chest, borborygmi, diarrhea, anal prolapse, difficulty in swallowing, diaphragm stagnation from excessive consumption of alcohol, hard lumps to the side of the hypochondrium, hypochondrial and heart pain in women, internal urgency, abdominal pain, unresolved attack of wind cold that leaves a tightness in the chest, and malaria. Case history: we have a woman of 54 suffering from severe anxiety and claustrophobia. She was afraid to go to the theater, church, or in the underground. She was anxious when alone at home and felt a tight gripping sensation in the chest. Her pulse was choppy and her tongue pale, but with a red tip. Clinical manifestations were due to deficiency of blood, depriving the mind of its residence and resulting in severe anxiety. Due to deficiency of blood and the typical sensation of tightness in the chest, the yin linking vessel was used, P6 on the right and spleen 4 on the left, producing excellent results. Function of yin wei mai: circulates jing, yin qi, and wei qi in the thorax and heart. It regulates the kidney-heart axis and calms the mind. The yin wei mai connects all yin channels. Yin deficiency will cause a deficient yin wei mai. Symptoms: pain in the heart, tightness in chest, depression, fear, panic attacks, restlessness, postnatal depression. Palpation of the scalene muscles and the origin of the sternocleidomastoid muscle. Point pair: we have the confluent point, PC6, Chongmai, coupled point, spleen 4, Chongmai, confluent point. Disease patterns: the following Zhangfu disease patterns can appear similar to a yin wei mai problem and have to be properly differentiated: heart fire, heart qi stagnation, disturbance in kidney-heart axis. Heart fire can be a result and further complication of heart yin deficiency. Cardinal symptoms: palpitations with heat sensation, hectic unrest and restlessness, ulcers in the mouth, tongue ulcers, stomatitis, fast speaking, endless talking, and aversion to heat. Stagnation of heart qi causes the qi to stagnate in the thorax. Cardinal symptoms: palpitations, feelings of constriction in the thorax, depression with a feeling of oppression, unable to express emotions. Kidney and heart represent yin and yang. The heart is located in the upper burner and the kidneys are in the lower burner. Physiologically, the heart connects with the lower burner through the kidneys, and the kidneys connect with the upper burner through the heart. The two organs are interdependent and counterbalance each other. The kidneys send water, or yin, to the heart to cool the heart fire, the yang. The heart sends fire, yang, to the kidneys to warm the kidney water, yin. Kidney yin is very important for the yin in the entire body. Heart requires the yin of the kidney in order to be able to house the spirit. Because the kidneys have more yin and little yang, and the heart has more yang and little yin, the interaction of heart and kidney is important to root the spirit. Thank you for your attention.
Let's now discuss yang wei mai, or the yang linking vessel classical indications. Chapter 29 of the Classic of Difficulties says, when the yang linking vessel is diseased, there is an alternation of feeling of heat and feeling of cold and irritability. chapter 41 of the simple question says, the young linking vessel causes backache with sudden swelling. Needle the point on the dividing muscle of the calf on the bladder channel 1 foot above the ground. This point is probably bladder 57. Li Zhen says, when there is sweating, aversion to cold, fever, and the pulse is floating on the front and weak on the rear position, it indicates a disease of the young linking vessel. The golden mirror of medicine lists the following symptoms of the young linking vessel: swelling and pain of the limbs, cold knees, paralysis of the limbs, with headache, bone and muscle problems of the back and loins, ache in the head, neck, and around eyebrows, hot limbs, numbness of limbs, night sweating, red and swollen eyes, spontaneous sweating during an invasion of wind cold, feeling of heat superficially. Classical indications for the young linking vessel. Classic of difficulties, there is alternation of feeling of heat and feeling of cold and irritability. According to the simple questions, there will be backache with sudden swelling. According to Jen, there is sweating, aversion to cold, fever, pulse floating, and on the front and weak on the rear position. According to Golden Mirror of Medicine, there will be swelling and pain of the limbs, cold knees, paralysis of limbs, wind, headache, bone and muscle problems of the back and loins, ache in the head, neck, and around eyebrows, hot limbs, numbness of limbs, night sweating, red and swollen eyes, spontaneous sweating during an invasion of wind cold, the feeling of heat superficially. Here we have a case history of a boy of 12 who had a middle ear infection, and the young linking vessel was used using triple burner 5 on the left and gallbladder 41 on the right, producing a complete cure. The Yang Wei Mai function. Yang Wei Mai connects all yang channels. Yang deficiency causes a deficient Yang Wei Mai. The direction of the qi of the flow of Yang Wei Mai is the same as the Yang Qiao Mai. Yang Wei Mai is able to drain fire in the gallbladder and liver. Yang Wei Mai nourishes the sides of the trunk, the lateral legs, as well as the lateral areas of the neck, head, and the ears. Yang Wei Mai disperses wind cold and wind heat. Yang Wei Mai symptoms. There will be fever with chills, pain or feeling of heaviness in the head, bitter taste in the mouth, difficult hearing, aversion to wind, neck pain, hypochondriac pain, hip pain, and lateral leg pain. Now let's go to Yang Wei Mai palpation. Palpation of the gallbladder channel along the iliotibialis tract and along the gallbladder channel pathways of the head. Next, okay. Yang Wei Mai point pair. Its confluent point is triple burner 5, coupled point with the Chong Mai. Its coupled point is gallbladder 41. This is also the Chong Mai confluent point. The following Sangfu disease patterns can appear similar to Yang Wei Mai problems and have to be properly differentiated. Wind heat in the lungs, wind cold in the lungs, liver wind, liver fire, and damp heat in the gallbladder. First, let's talk about wind heat in the lungs. The defense Wei Qi of the lungs is fighting against the invasion of wind and heat pathogenic factors. Wind heat in the lungs can be a reaction to wind cold in the lungs. Its cardinal symptoms are acute cough with yellow sputum, aversion to wind and heat, infection with fever, and sore throat. In wind cold in the lungs, here the defense or weak chi of the lungs is fighting against the invasion of wind and cold pathogenic factors. Cardinal symptoms: acute cough with watery or white sputum, aversion to wind and cold, sneezing, feeling chilly, and shivering. In liver wind arises from extreme yin-yang and qi blood imbalance. Hyperactive liver yang, liver blood deficiency or heat may all in extreme cases steer liver wind. The symptoms vary according to the cause. The cardinal symptoms of liver wind are hyperactive liver yang, liver blood deficiency or heat may all in extreme cases steer liver wind. The symptoms may vary according to the cause. There will be trembling, spasm, aversion to wind, sudden vertigo, and deviation of the tongue. In liver fire is an excess heat pattern and usually originates from liver qi stagnation. Cardinal symptoms. Symptoms of liver qi stagnation appear in conjunction with symptoms of liver fire. The presence of liver qi stagnation is the main characteristic to differentiate between liver fire and hyperactive liver yang, since they share the same cardinal symptoms. Irritability, severe vertigo, tinnitus with a high frequency tone, throbbing headache, migraine, conjunctivitis, redness of the eyes, red tongue edges. Next, we have damp heat in the gallbladder and the liver. Damp heat in the gallbladder and liver can result as a consequence of yin deficiency. Yin deficiency leads to heat, which causes the spirit to be restless. In order to compensate for the restlessness, the patient may eat dampness-producing foods, and damp heat in the gallbladder and liver is a result. For the cardinal symptoms, there is pain and fullness in the hypochondrium, pain in the testicles, jealousy, high-handed manner, jaundice, trouble digesting fatty foods, vaginitis, inflammation of the fallopian tubes, inflammation of the bile duct, inflammation of the gallbladder, bitter taste in the mouth, protrusion of the eyeballs, scrotal eczema with wetting lesions. Thank you for your attention.
Let's discuss the yin qiao mai, yin stepping vessels, the classical indications. The classic of difficulties, yang is slack and the yin tense. Spiritual axis, eyes want to close. Golden mirror of medicine, obstruction of the throat, difficult urination, chest distension, painful urination, berberine, abdominal masses from excessive consumption of alcohol, abdominal pain, vomiting, diarrhea, regurgitation of food, breast abscess, dry stools, difficult labor causing fainting, wind and blood from anus, discomfort in the diaphragm, feeling of lump in the throat. Chapter 17 of the spiritual axis says, the qi of the yin and yang stepping vessels reaches the eyes, moistening them. If qi does not nourish them, the eyes will be unable to close. Chapter 29 of the classic of difficulties says, when the yin stepping vessel is diseased, the yang is slack and the yin tense. This statement is generally thought to refer to the state of the leg muscles. This is yang is slack means that the muscles of the lateral side of the legs are slack, and yin is tense means that the muscles of the medial side of the legs are tight. Although this interpretation is correct, it should not restrict a broader interpretation of the above statement. In fact, yang and yin above could also refer to the back and front, head and abdomen, etc. Moreover, they can also be interpreted in a broader sense of the excess of yin. Yin is tense and deficiency of yang, yang is slack. Chapter 21 of the spiritual axis says, if the yang stepping vessel is in excess, the eyes stay open. If the yin stepping vessel is in excess, the eyes want to close. The golden mirror of medicine lists the following symptoms of the yin stepping vessel: obstruction of the throat, difficult urination, chest distension, painful urination, berberigme, abdominal masses from excessive consumption of alcohol, abdominal pain, vomiting, diarrhea, regurgitation of food, breast abscess, dry stools, difficult labor causing fainting, wind and blood from anus, discomfort in the diaphragm, feeling of lump in the throat. Case history: a man of 28 suffering from continuous somnolence. This followed a car accident during which he suffered a fracture of the skull. He came to the treatment as he was studying hard for an exam and could not keep awake. The point bladder 62 on the left side was reinforced to stimulate the yang stepping vessel. Kidney 6 on the right side was reduced to drain the yin stepping vessel, and the point bladder 1 was used bilaterally with even method. After only one treatment, the somnolence completely disappeared and he could not actually sleep for 2 days. Yin Qiao Mai function. Yin Qiao Mai brings Jing, body fluids, and nutritive qi to the head and eyes. If the Yin Qiao Mai is deficient, the Yang Qiao Mai has excess and the eyes are open and don't close and there is insomnia. If the Yin Qiao Mai has excess, the Yang Qiao Mai is deficient and the eyes are closed and unable to open and there is hypersomnia. The Yin Qiao Mai nourishes the heel, the Achilles tendon, the medial aspect of the leg, lower abdomen, uterus, and eyes. The yin channels guide excess, dampness, and cold in the yin qiao mai, which can lead to stagnation problems in the lower jiao. Yin qiao mai symptoms: dry eyes, disturbed sleep, abdominal bloating, pain in abdomen, myoma. Yin qiao mai palpation. Palpation along the medial aspect of the thigh along the kidney channel. In addition, check the hip rotators. An imbalance between external hip rotation and internal hip rotation points to an imbalance between yang qiao mai and yin qiao mai. So that's the illustration of palpation. Yin qiao mai point pair, confluent point, kidney 6, ren mai, focal point. Focal point, lung 7, ren mai, confluent point. Yin qiao mai disease patterns. The following sample disease pattern can appear similar to Yin qiao mai problem and have to be properly differentiated. Damp heat in the bladder, damp heat in the gallbladder and liver. If the patient has insomnia, check also for heart patterns. Damp heat in the bladder, damp heat in the bladder can result as a reaction to damp cold in the bladder. Cardinal symptoms: urinary urgency, painful urination, inhibited urination, disease, decreased amount of urine, cloudy urine, hematuria, sandy urine, acute prostatitis, acute cystitis. TCM information: symptoms, causes, treatment tips, root and branch point combination. Damp heat in the gallbladder and liver. Damp heat in the gallbladder and liver can result as a consequence of yin deficiency. Yin deficiency leads to heat, which causes the spirit to be restless. In order to compensate for the restlessness, the patient may eat dampness producing foods, and damp heat in the gallbladder and liver is a result. Cardinal symptoms: pain and fullness in the hypochondrium, pain in the testicles, jealousy, high-handed manner, jaundice, trouble digesting fatty foods, vaginitis, inflammation of the fallopian tubes, inflammation of the bile duct, inflammation of the gallbladder, bitter taste in the mouth, protrusion of the eyeballs, scrotal eczema with wetting lesions. Thank you for your attention.
So for cough, we discussed the following patterns: lung heat and lung phlegm heat. Lung heat is manifested as barking cough chest pain, breathlessness, fever, thirst, sweating, flaring of alanasi, restlessness, and a feeling of heat. Tongue is red with yellow coating, pulse rapid and overflowing. This corresponds to the pattern heat in the diaphragm within the Qi level of the 4-level identification of patterns. This pattern is seen only in acute coughs following an invasion of wind when the pathogenic factor has turned into heat and penetrated the interior. Treatment principle: clear lung heat, restore descending of lung Qi, stop cough. Points: lung 5, lung 1, do 14, lung 6, LI11, all needle reducing method. Lung 5 clears lung heat, restores descending of lung Qi. Lung 1 clears lung heat, treats acute patterns of the lungs. Do 14 clears heat. Lung 6, which is a Qi cleft point, treats acute patterns of the lungs and stops cough. LI11 clears heat. Now let's go to lung phlegm heat. There will be barking cough with expectoration of profuse sticky yellow sputum, fever, restlessness, thirst, feeling of heat, and a sensation of oppression in the chest. Tongue is red with a sticky yellow coating, pulse rapid and slippery. This corresponds to the lung heat at the Qi level within the 4-level identification of patterns, but with the presence of phlegm in addition to heat. Wind heat easily leads to phlegm because it quickly dries up the body fluids, which condense, forming phlegm. This is a very common pattern in acute cough. It occurs when an external pathogenic factor turns into heat, penetrates interior, and combines with phlegm. Treatment principle: clear lung heat, resolve phlegm, restore descending of lung Qi, stop cough. Lung 5, lung 1, lung 6, REN 12, REN 9, stomach 40, spleen 6, do 14, LI 11, TB 6, and spleen 15 are needle reducing method except REN 12, which should be reinforced. Lung 5 expels phlegm and clears heat from the lungs. Lung 1 and lung 6, front collecting point or front mu point and Qi cleft point, respectively, are used for acute cases. They clear lung heat and stop cough. REN 12, REN 9, stomach 40, and spleen 6 resolve phlegm. Do 14 and LI 11 clear heat. TB 6 and spleen 15 clear heat and move downwards. We have a case history of a 2-year-old girl who had contracted an upper respiratory infection, which had been treated with antibiotics. Her mother took her for treatment about a week into the antibiotic treatment. As she was not getting better, although the initial temperature had gone, she now had a barking cough productive of yellow sputum. She also wheezed slightly, was restless, and slept badly. Tongue had a sticky yellow coating and was red in the front part. Diagnosis: this is a typical example of progression of an external pathogenic factor into the interior due to treatment with antibiotics. The pathogenic factor is now interior phlegm heat obstructing the lungs. Thank you very much for your attention.